we should look out for? Like, how do we even diagnose? How do we know that our kids or this child has cancer? Are there symptoms that can actually help a parent, even when you're thinking it's infection, know that, okay, let's do these tests for cancer?
So the thing is, ultimately, and I've been around the merry-go-round with this, but this is where we've come to the conclusion we've come to. The truth is, very few parents want to think about cancer and their child in the same sentence. And the truth is, we don't want parents getting panicked every time their child has a fever, thinking that it's cancer, because it probably isn't. That's not the likely diagnosis. What we do want to say is that if a child is ill all the time, or if something is not normal, you should see a specialist, a pediatrician. And then we now want the specialists to be the ones to determine that something else is going on here beyond infection. We don't want them to treat the child for malaria and typhoid and then malaria and typhoid again. You know what I mean? Without actually looking deeper for what can be wrong. So as a parent, my advice would be that make sure that you're seeing a pediatrician, somebody who is actually qualified to treat children. Make sure that you point out the fact that this child has been treated for an infection 2 weeks ago, now he has another one. Is there something else going on? Seek a second opinion. I mean, don't keep going back to the same place, receiving the same treatment and things aren't improving.
So, everybody knows that to treat cancer is either chemo. How do you think this will affect children? Is it something that children can also go through? And, the entire process, how do you think it affects children? Is that the only solution or option to treat cancer in children?
There are 3 options to treat cancer: surgery, radiation therapy, chemotherapy. And when I say chemotherapy, that is, the entire range of chemicals that can be used to treat disease. So that includes hormonal therapy, immunotherapy, all of that. Anything that is not radiation or surgery is chemo. Now, children take chemo and they do quite well on it. They're more resilient than adults, if you ask me. The other thing is that I should just put out there is that children often have a better survival rate than adults. So many childhood cancers have survival rates of 90%.
How come?
It's not how come, it's the biology of it. I didn't make it that way. But that's just the biology of it. So many of these tumors, they are survivable, they're treatable, they're survivable. It's just very tragic what we have in our society, because they come when it's really advanced, and then at that point you can't cure anymore. But it's good to put it out there that, listen, many of these cancers have a very, very... I've told people for years that the first time I went to a pediatric cancer conference, there was very little talk about survival. It was more about long-term side effects, maintaining fertility, maintaining function. They weren't really discussing survival for certain cancers, because survival is taken for granted, in those conditions.
So, talking about the effects after chemo, of course, we know that there's always these side effects, weakness, and like you said, the survival rates are even higher in kids than in adults, even though you said it's based on biology.
For many of them, but not all of them, yes.
What are the side effects that, away from the sickness and weakness, that children might, undergo? What are the other side effects that they might have?
When you discuss side effects, you think early and late. So acute, the ones that will occur when you're actively in treatment, within a couple of weeks after treatment, and then the ones that are chronic, that develop years later, or begin acutely but remain forever, or remain for a long time. In terms of acute, the things that people see on TV that everybody thinks about commonly, the nausea and the vomiting and the hair loss, those ones are acute and tend to resolve once you're off treatment. The long-term side effects are the ones that are more worrisome in that, and especially for children, I would say that the most fearsome long-term side effect is the development of another cancer. Yes, as a result of the treatment. Because the way it works is that those treatments change things in the DNA at the cellular level. So they can become aberrant, number one. The second thing is that I always tell people that if somebody develops a cancer, they are at risk of developing a cancer. You know what I mean? So those things are there. I would say that's the most worrisome. For parents, there's also fertility. Fertility is a huge concern. The good thing with that is that there are options for preserving fertility depending on the age of the child, depending on where the tumor is, things like that.
It's not even exciting, because you think that you treated it and then you still have the chances of you getting it again or growing that tumor again is still very high.
Or another type. It's not. I wouldn't say that it's very high. It's not very high. But there just happens to exist a certain level of risk. It's not very high.
So it's obvious that detecting these cancers or these things or this, it's cancer. I like calling these things because we don't want them. But it's obvious that detecting it is early is the best way to treat it now.
Absolutely.
In your line of work, have you recently had more people come in for that kind of checkup early enough for it to be treated? Because most times you always hear, oh, it's a late stage cancer, it's a late stage cancer. So has that changed in your line of work?
I would say that for adults, it has changed to a certain extent. There is some bias based on where I probably work, because I'm in a very urban center. So what I see may not correlate with somebody who works, for example, I don't want to mention a state, not to offend anyone, but somewhere less urban, if you know what I mean. So there might be some bias in my perception. I would say that for children, we don't do checkups for children to look for cancer. We don't. What we want is that when they have a regular well child visit with a pediatrician, that person knows to look for other things.
Yeah.
And it's not as if again, like I always say, we don't want parents looking at their child and thinking, does she have cancer? That's not the idea.
Yeah. Any small thing they'll be looking at.
Exactly. That's not the point. The point is just to make sure that they're getting the proper attention.
Yeah.
If they're seeing a professional, the person would detect if something else is wrong.
Okay, so what are the things parents should look out for? Because I'm guessing that a lot of parents are actually watching this. What are the things that they should look out for in their kids? Not necessarily looking out at them, like you said, like every small sickness is, I've been at cancer, they worry my picking, that kind of thing, you know. But what are the signs that, you know, okay, this is not normal?
It's not normal. So
I need to go do checkup.
I would say that a mass or a swelling in any part of the body, especially in the abdomen. So many times there's a type of cancer called
So a
Wilms
mass,
tumor.
like a big
A
swelling, obvious
yes.
swelling.
Yes, there's something called Wilms tumor which arises in the kidney, and you often find that mothers detect it when they're bathing for their child. They find that the tummy is swollen, the abdomen is swollen, or
But they can also mistake it for hernia.
whatever it is. They need to see a professional. If they see a professional, the person will differentiate a hernia from an intra-abdominal mass. You know what I mean? Yeah. So I would say that a mass in any part of the body, even things that we think are lymph nodes. You know what lymph nodes are? You know, that get swollen when you have like an infection.
Yeah.
You should see a pediatrician. Repeated infections, a child who is getting, you know, infections over and over again. Wounds that don't heal on time. Now, this is what I say to people. Children fall down all the time. They keep knocking into things. They get bruised and then they get up and they move on. But when a child keeps getting bruised very easily, or they have a small cut and then it bleeds for a long time, that's something to watch out for with leukemia. I mentioned repeated infections already. I mentioned masses. Even things like not doing well in school. A child who has been doing well in school previously, who suddenly starts to decline in their schoolwork, needs to see a pediatrician, needs to see a professional. I would also say anything that has to do with balance. If his gait becomes abnormal, if he complains of having a headache, a child shouldn't have a headache. Adults are the ones who have plenty of headache.
Yeah, so they shouldn't be having back-to-back headache.
Yeah, so a child who has a headache, who is vomiting, whose gait is unsteady, who is falling down or is not working properly, any visual deficit, anything to do with changes in the eyes. And that brings me to talk about retinoblastoma. Retinoblastoma is a common cancer in children, and it starts in the retina. The retina is the layer of the eye that helps you to see. So it's a retinal cancer. A blastoma is the malignant transformation of blast cells. Blast cells are the primitive cells that you find in children. I'm just trying to break down the name. It sounds like a big name, but it's really not. You know, so
that's what the professionals always say. It's not a big name, but it's a big name. But continue.
I'm just trying to break it down so that you know. So one of the common cancers in children is retinoblastoma, and that tends to present with a change in the eye. Something, how do I put it now? A change in the color of the inner part of the eye. Okay, so what we usually tell people to look for is a change in color to white. It shouldn't be white. But what I say is any change. If it just looks strange, it looks abnormal. Something else that I would say is what we call strabismus or nystagmus, when you have like crossed eyes. That's not to say that if you see a young innocent child with crossed eyes, start thinking about cancer. Yeah. But the point is that child needs to see a professional who's going to make sure that this is just a normal thing, or this is something that requires more attention. Especially if it's something that develops over time. He didn't have it when he was born. Yeah. And then maybe at age 3, his eye starts to, you know, cross or something. So I think those are the most common ones I will talk about.
Okay. Well, you see, you work in an institute where they talk about these things. I mean, the NSIA-LUTH NSIA-LUTH Cancer Centre, and it's a public-private organization, and there's a partnership between that and the Nigerian Sovereign Investment Authority and the LUTH itself. But relating to government now and how they are supportive of these organizations in terms of funding, how far do you think they've gone, and how much awareness have they been able to push out there for people to really know that these things are real and they should start, taking charge of these situations in their homes, creating awareness even within their homes, going for regular checkups with their kids and all of that?
So what I would say is that in terms of government involvement, what I see that the government has done, and I'll just be very frank, what I see that the government has done in recent times is work more on policy, which is what you want government to do really. Advocacy and awareness is one thing, and there's a bit of advocacy and awareness going on, especially with non-profit organizations and co. But at the government level, what you want is policy. What you want is for it to become a matter of policy and a matter of
hospitals,
of protocol. Yes, across the nation, a matter of protocol that a child presents in this particular way, he needs to be in front of a pediatric oncologist within 48 hours. Those are the things that prevent late presentation abroad. It's not so much awareness, because like I said, there is no parent anywhere in the world who's going to look at their child and think, oh, I think this is cancer. Nobody's going to think that. What they do is they go to a healthcare professional. It is for the healthcare professional to make sure that that child sees the required specialist in a limited amount of time. What happens here is that they see a healthcare professional, and they do. I tell people all the time that, listen, even a woman who won't take herself to the hospital will take her sick child to the hospital because she won't rest until that child is well.
Yeah.
So they go to a healthcare professional, but then the child gets treated for malaria and typhoid together. And then they go again in 2 weeks, and then they treat him for the same malaria and so-called typhoid again. So it becomes a matter of policy to make sure that those things don't happen. And I think that's where government involvement is important. And so with regards to that, I know that the National Cancer Control Plan, for example, is now working to do a lot on pediatric cancers and, putting policies in place.
Okay, so just off the, chart, why is it so predominant that every cancer situation with kids, must there be hair loss? Was there? Like, must I lose all my hair?
No, so hair loss is actually very important because it's very distressing. People tend to brush it off because I think from a physician point of view, we tend to think, look, there are bigger issues at stake here.
Yeah.
And we tend not to think too much about the hair loss. But as a woman, as a young woman, I understand how distressing it can be. The thing with hair loss is that it is usually acute. Like I said, these are things that will resolve when treatment is over. What I do tell people is that your hair might not go back to the state that it was in before. But again, my hair today is not what it was when I was a young girl. And no amount of product has been able to save it.
Are you sure? I can recommend though.
Has been able to save it. So, not to make a joke of it, but here is the thing though. It will grow back after treatment. It may not go back as thick and full and strong as it was, but it tends to grow back. Again, it depends on the type of treatment that the child is having.
Yeah.
It depends on the type of drugs. It depends on the duration. It depends on which part of the body we're treating with radiation. If we're not treating the head, there's no hair loss, scalp hair loss with radiation.
Yeah.
With chemo, yes, there's hair loss everywhere, but it's not with all chemo agents, not with all. But even if there is, it will usually grow back.
All right. But lastly, how do you think that, what's the probability that a child can live longer than the 5-year survival rate of cancer?
So just anecdotally, I have a classmate, we went to school together, went to high school together, who had womb tumor when she was 3 years old. She has 2 children now. She's a professional makeup artist as well as several other things. So you can absolutely go on to live a very normal...
When she was 2 years old?
3, when she was 3, yes.
Her parents were really sharp.
It wasn't, again, the parents just took their sick child to the hospital.
So they noticed the swelling.
Well, I don't know the specific story, but I do know that they took her to hospital. A doctor said this and that. And I think at that time, this is decades ago, it must have been really distressing for them and all of that. But she went through treatment, she survived. And she's gone on to live a full life with one kidney. Yes, but I'm saying that's just, like I said, anecdotally. But the point is that I tell people, for example, with breast cancer, we have millions of breast cancer survivors in the world. It's the same with childhood cancer. The first person who was ever treated for retinoblastoma, a young boy called Gordon Isaacs, at that time I think he was 3 or 4 years old. he was treated with a linear accelerator that, I mean, imagine this is 60 years ago or something.
Yeah.
So it's not even the modern treatments that we're doing now. He lived till 60 something years and he was the first ever to receive that treatment with a radiation therapy machine. So the point I'm trying to make is that, again, for many of these childhood cancers, they are curable. For many of them.
So
I'm not going to say all of them, but for many of them, the important thing is detecting them early and getting the right treatment.
All right. Thank you so much, Dr. Adedayo. I know you've touched, in fact, you have touched on almost everything, if not everything. Yes, so thank you so much for coming, and I really appreciate your presence here. Of course, guys, I'm sure you enjoyed the conversation.
Thanks
if you were listening in, please do more research on this, find out, and be watchful of your kids. It's very, very important to be conscious. Thank you once again. We'll go on a really quick break, and when we come back, we'll continue with the rest of the show. It's still Silverbird Today, #Throwback Thursday. Thank you.
Thanks for having me.
Thank you so much.
All right.
Big Brother coming up. Gossips.
All right.